Hey guys, it's Dr. Rad here, and in this video I want to talk about the common root canal myths that my patients have for me. Myth number 1, do root canals actually hurt? This is a very common question, and 2/3 of Americans think that root canals hurt. And this is actually farther from the truth, and this is a huge misconception. Root canals are not supposed to hurt. With modern medicine, modern anesthesia, your gums and your tooth are actually supposed to be fully numb, so you should not feel anything during the procedure. This is one of the most common reasons that patients actually don't get the treatment that they need. They think that root canals or other procedures actually hurt, when in fact, it should not be hurting at all. Myth number 2, I don't even need this tooth, I'm just gonna pull it out. And this is a huge problem. When patients decide to take out a tooth instead of trying to save it with a root canal, what ends up happening is there's gonna be bone loss in that area, there's gonna be teeth shifting, causing TMJ issues, tooth movement, and a whole lot of problems when instead we can just save the tooth and prevent problems like this from arising. Myth number 3, once I get my root canal, my tooth is fixed, right? Well, in fact, root canal is the first step. Once we get the root canal and our tooth is clean and bacteria free and ready to be restored, the next step is actually we have to put a crown on top of the tooth. And this is to help prevent it from breaking and fracturing. And this is a must in the teeth in the back, but not so important of the teeth in the front. Myth number 4, patients sometimes tell me root canals do not work because they've had one failed root canal, or they've had friends or family that have told them that root canals do not work. And this is farther from the truth. Actually, the statistics are that 95% of root canals should succeed or do succeed in the real world. And this is true clinically as well. The prognosis or the likelihood of success of a root canal is based on 2 main things. One is the dentist doing the procedure itself, or the state of the tooth that we need to work with, right? So if we have a tooth that's bombed out, it's broken, it has a huge infection, huge cavity, the likelihood of trying to save this tooth is a lot lower than a tooth that is in a much better condition to begin with. Myth number 5, my patients sometimes ask me, my tooth doesn't hurt, why do I need a root canal? The body has an amazing way of relieving pain and relieving symptoms sometimes. A lot of times clinically we know that the tooth is in a condition that it needs to be restored with a root canal. And if we do anything other than a root canal, such as a filling or a crown, the tooth is going to flare right back up. So it's really important to understand that just because a tooth does not hurt doesn't mean that it does not need a root canal. A lot of times us as clinicians, we need to assess the likelihood of success of a procedure and make sure that we're giving the treatment that has the most likelihood of success.